Hello everyone. I am Jay Darji and I would like to take the opportunity to welcome you all in today's CellTalk webinar. Our today's presenter is Ms. Isha Shaw. She will be presenting on healthy lifestyle in late life, longevity genes and life expectancy among older adults, a 20-year population-based prospective cohort study. So Ms. Isha is working as a data analyst in Neuroanatomically life science. Her work involves collecting data about professors of engineering colleges concerned towards healthcare and the research projects or publications they have worked on. She is currently pursuing BA in English from Asansol Girls College. Prior to this, she has worked on Bobble AI as a transcriptionist. At Tranix, she has gained experience in not only data research, but also reorganization of information and time management. So without doing further time, without wasting much time, I would like Miss Isha to take the floor and take us through the presentation.
Thank you, Jeff, for the introduction. Hello, everyone. This is Isha Shah. Today, I'll be presenting on the topic healthy longevity, healthy lifestyle in late life, longevity genes, and life expectancy among older adults, a 20-year population based prospective cohort study. This research article was originally written by Jun Wong and it was published in the journal titled The Lancet Healthy Longevity with an impact factor of 13.1. It was published in the year 2023 and it falls under the category of longevity. So, longevity, as we all are well aware of, that it refers to not just the entire living duration of an individual, but also the healthy lifespan of that particular individual. And studies have said that the elderly population has been increasing globally. And by elderly, I mean people who are aged 65 or older. So, since this population is increasing globally these days, so promoting the healthy aging and promoting the longevity has become very crucial in the present times for the individuals and for the societal health as well. So, studies also say that following a certain kind of healthy lifestyle, which includes like not smoking, limiting the alcohol consumption, being active, exercising, and eating better diet, the things like these can reduce the uh, risk of a lot of diseases, which includes chronic diseases, and it lowers the risk of death as well. So, just a second. This lifestyle also correlates with longer life, especially if it is adopted in an early stage of life. And modifying these habits, if these habits are picked up in midlife, so this can also lead to a longer life without major health complications. Speaking of the general background, genetics, according to a lot of studies, say that genetics play a very vital role in determining the life expectancy of an individual, which uh, which like 20 to 30% of the longevity is completely genetic, which can also rise to 40% for those above 85 years of age. So the studies have found that genes that affect lifespan and previously a lot of studies were done on this for the effect of genes on longevity, but it was mostly focused on the younger population, younger adults, which left the question for us that if it is still viable for the elderly population. So this study aims to fill the gap of knowing this if the role of genetics is still viable for longevity in the impact of older life expectancy. The present challenges in front of us was the first was misclassification errors. It was because there was a possibility that it could have errors because the lifestyle factors in this were self-reported. So it is possible that it could have led to over or underestimation of the association of lifestyle and the risks. And the second one would be it is limited to a particular ethnicity, which is Chinese older adults. So that could be one of the drawbacks the study has. The objective of this research, as I spoke before, that it aims to of fill the gap of discovering if the genetics play a major role in uh, determining the healthy aging of an elderly, and if it affects the mortality rate, and if it differs based on the genetic risk. So, what happened was that for this analysis of lifestyle, genetic risk, uh, genetic data of 9,633 participants were included, and then their lifestyle factors were assessed. So, lifestyle factors which were assessed was like smoking, their alcohol consumption, the physical activities, and the diet they were taking. So, these factors were assessed at the beginning of the study. Then a healthy lifestyle score was created, which was based on these factors. So each factor was given a score of either 0 or 1. One indicated a healthy behavior, and 0 indicated an unhealthy behavior. So, and at the last, it was summed up, and there it showed that higher the score was present, it indicated a healthier lifestyle. The lower the score, the unhealthier the lifestyle. So on the basis of that, participants were then categorized into healthy, and intermediate groups based on these scores. Then the genetic data from a subset of participants were analyzed for SNPs, and the genetic risk score was calculated based on these numbers. And then participants were at last divided into low and high genetic risk groups based on these genetic risk scores. So as you can see from the table, it goes into three slides. So from this table, it was seen that participants with a healthier lifestyle were more likely be to be the ones who are young, to be the ones who are male, married, have an independent source of income, live in a urban area, and have higher educational attainment. From this table, From this table, you can see that a healthier lifestyle was associated with a lower risk of mortality rate, while a high genetic risk was associated with high genetic risk. But and participants with both high genetic risk and unhealthy lifestyle had the highest mortality rate, which is 127.62. And people with a healthy lifestyle, even under high genetic risk, lower uh, had a comparatively lower mortality risk than unhealthy lifestyle under low genetic risk. So this highlighted for us the importance of healthy lifestyle despite the genetic risk. The sensitivity analysis also confirmed the robustness of these findings. So in the study with the Chinese older adults, living healthily was kind of tied to a lower risk of dying and a slight increase in how long they might live. And staying active was like one of the most significant impact which could lower the chance of deaths. So through this research, though other researches are there which have shown that being healthy can cut the risk of big health problems, this research particularly showed us how being healthy and how the genetic factors can help you live longer, and then and that it also showed that being healthy can lower the risk of dying, and which can make you live up to 100 as well. So it showed us that genetic factors play a significant role in determining the mortality risk, and living healthily mattered even more for those who have a higher genetic risk. So and the mechanism behind this findings for sure requires further investigation. To sum up, this study actually showed us the importance to to live healthily so that the risk of dying, the risk of mortality can be lowered, and the elderly population can live longer, especially for those who have a higher genetic risk. And it's a kind of a reminder for us for how crucial it is to encourage the healthy habits as we age through through factors like lifestyle changes, specific policies, or teaching about health or developing better healthy habits. And future studies should also it gives a direction to the future researchers so that the classification of data can be done in a better ways so that we can know more about how these affect our mortality and aging. The impact of this research, I would say, is that this information can inform the public health policies, the clinical practices, and individual health choices, which will ultimately improve the healthy outcomes for older adults. So, the most important impact, I would say, is that it will be very informative for the elderly or the families of the elderly who will be taking care of their family members. So, it could be one of the things which can give them the knowledge of reducing the mortality of of their specific individuals. Thank you. That's all from my side. You can find me at isha@renix.org. Thank you.
Thank you, Isha, for this enlightening talk. So this brings us to the question answer session of the webinar, and the floor is open for audience to ask any question if you have. So I see Nupur has a question that do they specify SNP is responsible for genetic risk factors?
I'm not sure of that, Nupur, but I will surely look into that and get back to you.
Okay, so I see no further questions in the chat box. So this brings us to the end of this CellTalk webinar. Thank you, everyone. Isha, can you please change to the next presentation slide?
Yeah, sure.
Yeah, so our next presentation, next presenter is Divya Lakshmi Ramakrishna. She will be presenting on longevity of composite restorations is definitely not only about materials. So that will be taking place at 24th of April 2024. Thank you.